Okay, well, let's go on then. Are you ready, Alexandre Petit? Alexandre is from the group of Guy Rimbaud, so that's going to be high quality, and he's going to do two talks, one on the long-term results of the Malingue technique in the surgical treatment of Dupuytren's disease, and then he's going to go on with the middle phalangoectomy with shortening fusion of the fifth finger in Dupuytren's digital hooks. It's not 7 minutes, it's 14 minutes. Go ahead, Alexandre.
So, dear colleagues, I'm not Thomas Albert. He's one of our fellows. He couldn't be there today, so I'm the one presenting this study, which was his medical thesis. I will be presenting the long-term result of using of the malingplasty in the surgical treatment of Dupuytren's disease. There are many possible surgical approaches for Dupuytren's disease. The malingplasty is one of them and was described in 2002 by a French surgeon. It's actually a modification of the Z-plasty to which two counter incisions have been added. What's great about this technique is that the flaps have better blood supply and the neurovascular bundles are easier to access. Our team studied and published a detailed description and mathematic model of the technique. So this was a single-center retrospective study of patients operated on in our center, which were followed up after more than 5 years. The main objective of the study was to assess the recurrence rate using the criteria of both Caroline Leclerc and Felici. All patients had been operated on by the same highly experienced surgeon. So what about the results? 55 patients were included in the study. Results were good, especially for the middle finger and the ring finger. Only the little finger showed a significant loss of correction. All preoperative deformities were corrected postoperatively. There were no postoperative complications, whether in terms of skin necrosis or iatrogenic injury to the neurovascular bundles. No infections or hematoma were reported. Mean quick DASH score was good, and the overall Michigan questionnaire score was excellent. In terms of recurrence, our series shows an overall acceptable recurrence rate comparable to the best series in the literature. According to Caroline Leclerc criteria, the recurrence rate was 50%, which is comparable to an earlier series by Fouché. According to the more widely accepted criteria by Felici, the recurrence rate was less than 30%, which remains acceptable compared to other series in the literature. According to the more widely accepted criteria, the aesthetic and functional results are also very satisfactory compared to the other series. The absence of complication in our series shows that this technique is reliable when performed by an experienced surgeon. Of course, our series has its strengths and weaknesses. The main strength is that the first series to study this specific technique with a long follow-up. Although malingplasty did not improve the recurrence rate in Dupuytren's disease compared with other techniques, its advantages in terms of functional improvement and complications make it an interesting surgical option. So try this technique, publish your results. you'll see it works great.
Your question? Who was the experienced surgeon who did the procedures?
Jan Sinka, it was Jan.
Jan Sinka, yes. Okay, thank you.